Mayo Clinic's Dr. Rafael Sierra wants to set the record straight about aging and joint replacements.
The perception out there is that everybody's going to need a hip replacement down the road, whether it's knee or hip. Everybody's going to need some form of replacement. That's not necessarily true.
He says it's not aging, but anatomy that will predispose people to knee or hip replacements down the road.
This is a perfect example. This is a patient that had a slip when they were very young, and see there's an abnormal shape to the femur, and this abnormal shape will cause damage of this affected bone into the socket that would lead to hip arthritis.
Joint replacements today are more successful than ever thanks to precision robotic surgery.
And today, with navigation systems, robotic systems, precision is what is now achievable in almost every patient.
For the Mayo Clinic News Network, I'm Jason Howell.